This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. Anger is considered an entirely normal behavior.
Pag sinabi mong anger, it's a kind of emotion na ine-express pag meron kang mga frustrations, failures, yung mga takot mo, na kumisan, pag wala kang ibang ma-express na emotion kung hindi itong tinatawag nating anger.
Your anger may spring from an unpleasant experience or lingering problem at home, or a traumatic event that happened to you in the past.
Magkakaroon ka ng physiological effect. Yan yung tumataas yung blood pressure mo, or merong pagkakataon na sa sobrang extreme yung galit nito, maaari atakihin ka pa sa puso.
And when anger gets out of hand and appears to be never-ending, it can also jeopardize your relationships, job, and general well-being.
Ang mahirap dito kasi may mga pagkakataon na you deal with it na nanggigigil ka, tapos ayaw mong ilabas yung galit. So, merong tinatawag tayong suppression. It can turn into a possibility na maging depression. So, yung kaakibat nitong anger nito, maaaring magkaroon ng possible mental disorder.
It can also pose a problem when you're already consuming alcohol and taking illegal drugs just to manage your anger. What techniques can you employ to keep your anger in check? What is the right time to seek professional help? Find out the answers tonight on MedTalk. And joining us tonight is Dr. Robert Mapa, Medical Officer 3 of the National Center for Mental Health. Also with us is Dr. Ronaldo Elepaño III, the Consultation Liaison Psychiatry Fellow of the Department of Psychiatry of the Medical City. You may join our discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening, Angel.
Anger. Understanding anger, which is a normal human emotion, but it can affect our health, our mental and physical well-being. Let's understand anger first. What is anger?
Anger actually is as you were saying earlier, it's a normal human emotion. So if you would want to define it, it's characteristically an antagonistic behavior towards someone or something that you feel may have wronged you.
Mm-hmm. Okay. It can also be a form of aggressive behavior, so it can be manifested physically and internally. So this will then be defined as the types of anger. So there's anger towards self, and then anger towards others.
Mm-hmm. So there's anger towards self and towards others, and there are certain triggers that make you get angry at yourself and at others. So what are these triggers?
To simplify it, let's, for the sake of the audience,
yes,
you
please.
know, anger towards others is the easier thing to define. Anything can make you angry, you know. The traffic situation, your boss, a loved one can actually make you angry. And the more difficult part to define is what triggers you when you have anger towards self. You know, psychologists or psychoanalysts will explain it as a means to temper one's feelings, because there's ambivalence, there's a lot of feelings that are contradicting within oneself that produces anger. Some of them would be guilt, some of them would be depression. Anger could be a means to punishment, and a lot of other things, you know.
And this type of anger to self and to others, I understand there are certain levels. Because can one be angry and be calm?
One be
angry and still calm? Is that possible?
Yes.
Na you're
actually.
angry pero kalmado ka?
Yes,
Posible
yes.
ba yun?
Yes,
And
actually.
I am asking this because there are certain levels. No? If you're calm and you're angry, then the flip side is that you're really
are enraged by a certain situation or a certain person. So are there different levels of anger that we should know and understand?
It can range. It covers a vast spectrum. Some makes a bit mild or moderate anger, and then on the other side, you have persons who have expressed fury or rage. But then that's the line actually between these. The actual spectrum is very vague. So you can actually put a definitive.
There's no working definition as to the levels of anger, but in our profession, we actually define pathologic anger when one actually has dysfunction in one's life. So from the professional perspective, they cannot work, their relationships are compromised because of the anger. This becomes a problem. Of course, to the highest level would be when they have problems with the legal system. That becomes also pathologic in a sense.
So problems with the legal system,
Yes.
problems in their environment, and
Interpersonal,
interpersonal
social,
and health.
Yes.
Health. What happens to a person's health, or how does the person get affected physically and emotionally when he's angry? What happens?
When a person is actually angry, there are physiologic changes that happen within the body. They might have hypertension, may have experienced migraine. They may experience migraines. They may have tachycardia, increase in the heart rate. That's on the physiological level. But then they may also some patients may also, with chronic anger, they may also experience depression. So there's it affects both the physical and the mental levels.
This is actually what we call a stress response. You know, our body is always assaulted by stress, and how we respond to it affects us physically and physiologically. You know, also mentally. You know, as what Robert has mentioned, mentally one may actually activate an underlying psychiatric condition. They may undergo depression, psychosis to a certain extent. On the flip side, one's physiologic reaction will involve racing heart rate, sugar imbalances, and one can actually have physical complaints like back pain, chest pains, sweaty palms. All this can be manifestations of anger.
But anger is normal, and everybody gets angry at some point in their life, or sometimes even every other day when there's a trigger, people get angry. But when do you know that it's really affecting your health already, and it's not anymore the normal emotion of getting angry?
It's a little bit difficult when it talk about anger and health. You know, sometimes it's a little bit too late already to determine. So part of our role in the hospital is when we liaise with different parts of the hospital that screens preventive health maintenance. We actually screen for patients coping mechanisms, coping responses, and advise them to see, to try to, lessen their emotional expressivity, because it can actually affect their health. On the other hand, if you actually start having problems interpersonally, as what Robert has mentioned, if you have problems with the law or with work, this is the time that you actually need to seek professional help.
Doc Robert.
I just wanted to add.
Yes, please.
Anger itself is neither bad or good. We were saying that it's normal. But then in some cases, it can actually be positive. For example, when you want to incite change, normally anger is when a person feels anger, that's when a person feels anger because he or she feels slighted, then that acts as a trigger. And then in a bigger level, for example, for changes in that may involve for example, yung mga riots, or for example, yung People Power Revolution.
Yes.
You could see that there was that started with anger as a collective against the ruling class. So we cannot really say that it is a negative symptom per se.
Since we're talking about the positive and the negative of anger, expressing anger, I understand you express, and then you sometimes you suppress your anger, and then you resolve the anger after. Let's talk about expressing the anger first. What is normal, what is positive, and what is negative when you express how angry you are? Doc Robert?
When you express your anger, it's actually, you can express it through behavioral manner, in a behavioral manner, such as throwing things on the floor, throwing stuff around, or you can also have a verbal expression, for example, yelling, cursing, and shouting. It becomes you have to, since we're talking about anger itself being normal, it's actually how you express it that determines whether it in itself is being pathological already. That's for the expression of anger.
Part of managing anger is expressing anger. So in the clinic, sometimes when we actually try to manage anger, we allow patients or clients to express anger within the confines of the clinic, which actually becomes a safe space to release anger. On the other hand, if this is not guided accordingly, it can be a conditioned response that every time you get angry, you just express it and you don't care who gets in your way, which can actually lead to problems.
And in leading to problems, sometimes when you are angry, you suppress that anger because you don't feel like releasing it, because you don't want to harm anybody, to harm things around you, or like what you mentioned, Dr. Robert, to throw things at a person, or sometimes even hurting yourself. So is suppressing anger normal? Is this advisable as medical experts?
It can be to a certain extent. There are studies that actually recommend suppression of anger as a means to treating anger. Because, anger is, as what we've been talking about earlier, it's a variety of symptoms that it can present with. So when you say you're angry, that you want to kill somebody, that's something that you don't want to express, right? So you need to suppress these types of anger. And this is something that you actually talk about in therapy. But when you become conditioned, as what I was talking about earlier, with expressing anger, you can actually cause a more severe form of response when you continually or constantly suppress one's anger. It can cause depression, it could cause psychosis, it could cause anxiety, which is also symptomatic of internalized anger.
Pero sometimes kasi, di ba, different individuals treat anger or acknowledge or express anger in different ways. Yung iba, they keep it in. And sometimes after like several situations of being angry, that's the time they blow up, which is also very harmful to their health. What can happen to an individual if they suppress this anger?
I think in addition to what Dr. Ron said earlier about suppression, it's important not just to suppress, but to redirect the anger. There are certain things that are socially acceptable, things that you can do or engage in order to release, not just to suppress, but at the same time to channel it to a more socially acceptable form.
What is a socially acceptable form in channeling this anger instead of suppressing it?
Yes. For example, engaging in sports or engaging in behaviors that, for example, sports itself, it's a very physical activity. Then you are channeling the energy from the anger that you feel in towards that. So there. Suppression itself is not, it's harmful per se, but then if you redirect it, then that can be a lot more alleviating.
So you release all this anger by exercising or getting into sports right away?
Well, this is also controversial. There are studies that says it could be more harmful to actually use exercise as a means to suppress or control one's anger or release one's anger. Because you have to understand that the physiological response to anger involves increase in blood pressure, changes in one's blood sugar, and all other things. And when this is active and you actually engage in physical activity, it's practically adding fuel to the flame. So you're making things worse, so to speak. So what's advised is actually to use exercise as a means to manage one's anger. That just means that you don't exercise only when you're angry. You exercise on a regular basis.
So when you exercise on a regular basis, when you're angry, then it has become a habit. Is that right? You don't need to seek exercise just to release that anger that you
Yes,
feel.
yeah,
Okay.
exactly.
Any other tip for releasing this anger while we're still on the topic of suppression, aside from exercising? Is shopping therapy for anger? Or, you'll try to find anything and everything just to release that anger instead of lashing out at someone. Maybe write it down.
I always
That
say
help?
for a variety of clients, and we are different individuals, different folks, different strokes.
Yes.
You need to find what works for you. Trial and error, but practice makes perfect. You can't readily just try one form of way to manage your stress and not do it regularly. You find what appeals to you. For instance, meditation. Some would actually do yoga. Some would actually listen to music or play music, and some would actually just keep quiet and take deep breaths. If these techniques work for you, and as long as you practice it on a regular basis, these are things that can help managing one's anger.
I was about to ask resolve, but you already mentioned all the things that we can do to resolve this anger that we feel. Doctors will talk more about anger management when MedTalk returns.
Did you know that several studies suggest that anger and stress can lead to heart attacks? So if you want to avoid such discomfort, you must learn how to relax, laugh a little, love your heart, and enjoy your life.
We're back here on MedTalk, still talking about anger management. Before we cut to the break, we were talking about the resolve when it comes to managing, controlling, understanding, and just letting go of that anger. So you'd like to close that part, Doctor?
Yeah. Part of the bulk of the work in terms of anger management is actually psychotherapy, talk therapy, so to speak, and getting to the root of one's anger, understanding why one is angry is most effective in eventually coming to terms with one's anger and resolving it. So if the techniques that we were mentioning earlier doesn't work and you've tried it for quite some time and you're experiencing what we call the pathologic type of anger, one may consider going to a therapist to deal with this problem.
And the family members should also be supportive.
Yeah, definitely.
Encouraging, not because they want to let that person down, but because it's not healthy. If
Well,
you
most
have
family members will actually encourage,
Really?
patients who have anger issues to
Right.
seek consult.
How
Because
about
they're the
the-
ones who are affected by the brunt of one's anger.
But one has to recognize that he needs
Yes.
help,
Yeah.
that he is angry, and it's not just the normal
There
human
lies the
anger.
rub, because
Yes.
the ones who are experiencing anger issues sometimes are not aware of these problems, hence they don't like to seek consult.
Right, or they don't want to talk. And speaking of talking, we're going to be talking about the myths that surround anger. You mentioned earlier you have to talk to someone about how you feel, and then you express this type of anger or the kind of anger, or who even angered you for that matter. Myth number 1, and I'll read this because you're both guys. By nature, men are angrier than females. Is this true?
It's actually false.
Okay.
In general, men and women experience anger the same way. It's just the difference just lies in how they express it. For men, for example, whenever they feel slighted, they feel that they have to act upon it immediately. They perceive it as an insult to their ego. But for women, they tend to see anger as a counterproductive emotion. In that being angry will not lead to resolution. That's why they tend to keep those things to themselves. But for men, they feel that if they do not do anything immediately, then they feel that their masculinity is impinged.
It also the myth is based on the biological basis for aggression or anger. You know, one of the implicated chemicals that is that produces anger is testosterone. Hence, males are supposedly angrier than females by nature. It also goes with how one would actually perceive anger. Anger is normally perceived as one who would shout, be physically violent, and men are usually concrete thinkers. So when they are angry, they would actually become physical when they express anger, as opposed to women who are more abstract in their thinking. They like to toy and play with their emotions. So when they're angry, it's more on an emotional level when they express anger rather than physically expressing anger.
So when men are angry, what should women do? Knowing that, what should women do?
In any case, when anybody is angry, one should actually take a step back. You don't want to fuel one's anger by actually engaging a patient or a person who is angry. That the same holds true for our clients. When we actually deal with angry clients, we don't normally engage them, go in guns a-blazing, and confront a person who is angry.
Okay.
Take a step back.
So just let the angry person let it go. Just to let it go.
Let them ventilate, so to speak.
All right. Myth number 2. Anger is only a problem when you openly express it. This is what we were talking about.
Yes,
just
earlier.
take a step back
Right.
and let it go. Let them express it. Does it become a problem when you do that?
It works both ways. Open, as what we were mentioning earlier, expressing and suppressing anger
Yes.
can actually be problematic on both levels.
Okay. Myth number 3. The older you get, the more irritable you are.
Okay. There is some truth to that. It depends on where you would like to, and what perspective you would like to take with regards to this myth. But I would say that if you have a personality problem, you actually temper with age. So if you're irritable by nature, you're high-strung when you were younger, you actually mellow down when you're older. Because you
agree.
actually don't have the energy to be angry all the time. When you are more irritable as an older individual, this could actually be a symptom of a possible disorder like dementia. So some may actually misinterpret it as, oh, they're just getting older, that's why they're irritable. But the truth of the matter is, the mind is fading away. That's why they're very irritable, because they have difficulty remembering things. They get frustrated. And I would suggest that if a person, an old individual, wasn't irritable before and they became irritable at their older age, it's important, it's imperative for them to be seen by a doctor.
Okay. Myth number 4. Anger is all in the mind. Doc Robert, is it all in the mind?
Actually, if you put it in the locus, when you say it's all in the mind, often we hear people saying, wala, nasa ano lang yan,
Sa isip mo lang yan. Wala din yan, yes.
But then, to a certain extent, because we were saying about anger, it's normal. So it's not, it's like you're actually, anger itself is experienced by everyone. So you cannot really label it or ascribe it only to certain people. So by that in itself, we can see that it's not really it's not a myth, because it's a myth, since there's a need for it to express that anger.
There's partial truth to this myth, actually. You know, of course, when psychiatry was in its infant stage, most of what we would explain, the type of behavior that we see, is all in the mind. You know, you actually think about it, you do psychoanalysis to treat these problems, but you now see more and more research that says anger, as what we were mentioning earlier, is a spectrum, and it depends on the root of the anger. It can be biological. As we said, if a person is actually taking steroids, for instance, and they become addicted to steroids, they can present with what we call roid rage, steroid rage. So they become angry, and this is no longer in the mind, there is a biological basis for that. If they have epilepsy, if they have bipolar disorder, and other types of illnesses, this can present with anger, agitation, aggression, which is not simply explained by anger being in the mind, but rather a biologically driven type of anger.
Myth number 5, doctors, anger is inherited. Is it in one's genes? Or?
We were talking earlier about the difference between normal anger and pathological anger. So there are studies that have shown that in the cases of the latter, with the specifically we call it intermittent explosive disorder, there are studies that show that there is a genetic basis that patients who do have this disorder may trace the roots back to their parents. So there is, in a certain extent, it can be actually inherited.
Also, one's temperament is inherited. This is biologically predetermined. This is something that you inherit from your parents. You know, sasabihin siguro ng father mo or ng mother mo, para kang tatay mo, para kang nanay mo sa ugali mo. And that is because that is genetic, that is inherited. And anger is actually a combination of all of everything, one's genes, one's psychology, one's social exposure to create that kind of anger that you actually express.
Hopefully it's the normal kind of anger
Yes.
that you've inherited. Okay, myth number 6, anger is an uncontrollable force of nature and cannot be controlled. Can you control your anger?
Actually, anger itself, you cannot control it, but what you can control is how you express that anger. Since this is a normal part of the human emotion, these feelings will come up when you're faced with a situation that, for example, presents a threat to your safety. But then how you react to that stressor, that's the thing that you can control.
Like, for example, your flight is delayed or your flight gets canceled. What is the normal way of expressing your anger? Doc Robert or Doc Ron?
It's actually cultural, you know. Some would actually, Western countries are very outwardly expressive about their lack of acceptance to that kind of situation.
Yes.
You know, they would tend to tell the ones who actually are running the show, so to speak, and tell them that I'm unsatisfied, I'm angry, as opposed to us Filipinos who are more non-confrontational. They would actually be angry on the sidelines rather than confront the bosses head on. But ultimately, if it doesn't lead you to actually have legal problems, you don't get jail, you don't, assault anybody, that's okay. In terms of controlling one's anger, one has to identify if one's response to anger is problematic. If it isn't, why repair something that's not broken?
How do you become rational when you're so angry?
Easier said than done.
Yes, how? Is there a way? Is there a tip? Is there a trick?
I think there are some short-term techniques that you can use. For example, when you're engaged in a fight with someone, we teach patients to do certain techniques such as deep breathing techniques or relaxation techniques. We tell them to, like Dr. Ron was saying, or to take a step back, to distance themselves from the situation. These are the things that you can actually do in the heat of the moment.
Okay, all right. Yes, Doc. Before myth number 7.
One may also consider not doing anything when they're angry.
So tahimik lang.
You can be angry but not actually engage in a fight when
Okay.
you're angry. As what we were talking about earlier, you can shout, you can yell, but
You
you
can-
don't have to fight with somebody when you know that you're angry.
So be assertive but not aggressive.
Yes.
Yes.
Okay. That's difficult, but we can try.
But it's practice. As I said,
Yes.
these techniques won't work if you're going to use it only once. Try it once and abandon it completely. You have to practice.
So this applies to any situation that gets your goat, that gets
Yes.
you angry. Myth number 7. Anger can be relieved or released by hitting, kicking, or punching things, yelling, etc.
I
This is
think
really
that-
so much anger.
Right. I think that, if I'm not mistaken, there's a restaurant somewhere in the province wherein you, for a certain fee, you can throw plates or
Really?
even plates, cups, even I think small appliances.
So you go there when you're angry?
Yes, and then you pay a minimum amount in order to do that. But there are studies have shown that this is actually counterproductive in that it might actually reinforce the anger itself. So I think it's more of, like we were saying earlier, it's how you express these things, such as throwing stuff and may not
Yelling.
actually be helpful in the long run.
It has to be done in a controlled environment.
Like in the clinic.
In the clinic, certain techniques such as hitting a doll, punching a doll in the clinics is something that can be done. But as what was mentioned earlier, this actually adds fuel to the flame when you become physical and you know that your blood pressure is racing and all the other physiologic responses is there. It cannot be helpful or healthy as a means to cope with anger.
Okay, doctors, we have a caller on the line, Clara. Hi, Clara. Good evening.
Hi, Miss Angel. I would just like to ask po,
Yes,
kung
go
meron po bang mga actual medications na pwedeng i-take po ng mom ko kasi lagi talaga siyang galit. Thank you.
You're welcome. Pero stay on the line lang para
Okay
marinig mo yung... Hold on. Okay, doctors, medications for her mom who's always mad.
Always angry.
Yeah.
One must consider first doctor's assessment. One must go to our clinics and have them assess to identify if there really is a need for medication. There are medications that can help with anger as long as it's identified that there is a need for medications. If it's not necessary, we can still employ these techniques. Therapy can be helpful. And ultimately, if it's warranted, we will give medications for anger.
Okay, so Clara?
Yes, Miss Angel. Thank you po.
Okay, you're welcome. All right, doctors, we'll talk more about anger management. Let's talk about the fast and the furious, road rage and aggressive drivers when MedTalk returns.
Aggressive driving and road rage.
Road rage is defined as it's an emotional state of anger and hostility, which might lead to a violent act or a criminal act. This is a result of operating a motor vehicle.
These are serious issues that deal with anger on the road. According to the National Highway Traffic Safety Administration, or NHTSA, road rage involves a criminal act of violence.
Mas prone tayo sa road rage because of the environment. Ang isang factor na which adds to road rage yung traffic condition at saka yung weather, kung mainit. At saka ang tendency ng mga Filipino drivers, yung bang may pupuntahan, nagmamadali, last minute kung minsan maalis. Tapos pag if they're caught in a traffic situation, doon sila nagagalit.
If not managed carefully, these aggressive behaviors can lead to unnecessary verbal tussles, physical assaults, and vehicular accidents.
You have to take a holistic approach sa defensive driving. Hindi ibig sabihin defensive driving na when you're driving, be careful na baka yun nga, mabunggo ka. That's our concept of defensive driving kasi na even if you're careful, the other party might not be careful, the other driver, pwede ma-accidente. We go beyond that. No? We go towards educating the driver about his attitude, the proper attitude, proper driving attitude.
We're back here on MedTalk, still talking about anger management. Let's call this segment Fast and the Furious. Road rage and aggressive drivers or driving. Difference and similarity between the two?
When you say the first one is
road rage.
No, aggressive driving.
Aggressive driving, okay.
When you say aggressive driving, this refers to unsafe practices that are deliberate. But when you compare that with road rage, when you say road rage, as we saw earlier, it may actually lead to unsafe practices that may deliberately lead to hurting or maiming someone. So again, it's a question of extremes.
Road rage also entails one having a trigger that creates that emotion that drives them to behave that way.
So drives them to behave that way. So what are the factors that drive them to become angry behind the wheel?
I think it can be anything as simple as tailgating or someone driving slowly on the left side of the lane. These are the things that you might get irritated about. But then if a person does have anger issues, then these simple things, small as they may seem, may actually serve as triggers for them to have these episodes.
You have to take into consideration the type of driver that actually presents with road rage. You know, these persons who have road rage already have the underpinnings, and they are predisposed to become aggressive in the road. So little things that actually could trigger them can actually create road rage.
How do you determine if one has road rage? Is it how often should one be angry on the road for him to be diagnosed with road rage, or does it happen once and then you're considered to have road rage?
I think actually road rage itself is not really considered already or termed as a disorder, but then it's actually, you could consider it as a manifestation of intermittent explosive disorder, which we were talking about earlier, which actually deals with poor impulse control. But apart from road rage, this may also involve domestic violence. It may also involve stuff like that. There's no clear and definitive definition as to the number of times that a person engages in unsafe driving practices or that would constitute that. So it's just basically the reaction, how he or she reacts to that particular
situation or trigger
at that time.
Road rage is not actually a medical diagnosis. From our profession, even psychologists has not actually considered road rage as a diagnosis. It's actually a media type of diagnosis. When media has actually seen a lot of drama or aggressive behavior that they were able to caught in camera, they defined it as road rage. Ultimately, one has to identify the cause of the rage. One would be intermittent explosive disorder, and then other things, if they're schizophrenic, if they're bipolar, if they have a personality disorder that makes them aggressive and driving. These are possible reasons why they present with road rage.
If you're inside the car and someone is going through road rage, what should you do? How do you help that individual when he's already so mad and maybe attempting to get down the car and maybe hit someone or other manifestations of someone who's so mad, and you're inside the car with this individual? What do you do?
I think that being the companion, the primary goal is to ensure safety. So being that the person is already in an enraged state and he's driving at the same time, it should be important in order to how to assess, in order to temper that person's anger and to remove him from that situation. For example, if he's driving along the middle of the street at a fast pace, then I think it should be, as a passenger, it's your duty to be able to calm him down and gently guide him towards the side of the street where other cars may not miss. It's actually quite difficult, being that if you consider the person's enraged state, but at that particular point in time, that's probably the primary goal that you should have.
There is something that we do as therapists, and something that I also teach the healthcare staff in the hospital, because we get a lot of enraged individuals or family members or sometimes patients. And how do you engage these people? We tell them to stay calm and talk to them in a calm manner. You don't have to match wits with an angry individual. We call them lending your ego to an angry individual. You let your mind be that angry person's mind, so that they can think more clearly. That's the best that you can do at a very difficult situation when you're dealing with road rage.
This is when you're with someone inside the car.
Yes.
What if you're the only one inside the car and you're so angry and you can't take a step back? What are the signs that you're already so mad, and how can you help yourself?
It's first and foremost, you have to have what you call theory of mind. You have to be more, you have to be able to introspect, think, reflect. But when you have road rage, it's not that easy. But in retrospect, most of those who actually have road rage, once the angry feeling has dissipated, they experience a certain level of remorse. So this is the time that we catch these individuals. I do this a lot in my work with cardiac rehab patients. These are patients who actually are on rehabilitation post-MI, post-heart attack. They undergo bypass surgery. And one thing that I've noticed about them, that these are people who have type A personality. They're very aggressive. They're the ones who get easily angry in the roads. And then we tell them that you try to temper, change the way you think, redirect the way you think when you are driving. There's really no point getting angry. You can actually put yourself in harm's way when you get angry, and you become aggressive when you're driving. And you always keep that in mind when you're driving. It's easier said than done, but it is possible. As what I was impressing earlier, you have to practice. It's not going to work just because I told you to try it out once. You have to practically teach a right-handed person to write with their left hand.
Do they teach this in driving school?
If you go into driving school, theoretically you should be taught about road rage, but unfortunately not everybody goes into driving school. So maybe something in our country that can help lessen or address the problem of road rage is actually an educational campaign to teach drivers to handle their rage in a healthier manner.
So aside from, you have your patients, you tell them to, stay calm and recollect your thoughts and all these things. But these are your patients. How about our viewers or those who have encountered similar situations? Like what we've been saying, it's easier said than done, but it can be done. So if you were to give a tip to those who find themselves in a situation like that, what should they do?
I think it can be anything as, something as simple as deep breathing techniques.
Again,
we tell them to inhale and exhale slowly for a certain number of exhalations. And then there's also such a thing as progressive muscle relaxation techniques. So these are things that may seem simple and but then they do provide benefit in the long run.
There is such value in the use of deep breathing. If you do it properly, inhale through the nose, expand the chest, expand the belly, and then slowly exhale through the mouth, contracting the chest and the belly. Do this for 10 counts or more when you're angry. It can actually dramatically reduce one's anger. The other thing, once you've actually done this, you can actually start challenging the angry thought. Most of the time we are angry. When we are confronted with that situation, when we're angry, there's a thought that is attached to it. You're angry because it's traffic. Now, there's always a counter argument to that, and maybe start a debate in your head to help dissipate that anger. What's the point of getting angry when it's traffic? And if you actually use that as a mental peg, it will help decrease and dissipate, and actually eventually resolve one's anger.
I hope the anger is sometimes you're stuck in traffic. You have a meeting. They're calling you. They're texting you, and that adds. That aggravates to the anger. Earlier we said, before we cut to the break, you should release that anger. So if you're inside the car, can you shout inside the car? Are you allowed to increase the volume of the music in the car? Will that help?
You can. You
It
can
depends
actually.
on the person and what he or she finds
Yeah.
soothing and
Yes.
calming. So, like we were saying earlier about expressing.
Yes,
So they
yes.
do express it differently.
If that is something that appeals to them, shouting in the car, playing loud
Not shouting
music.
outside and
Yes.
putting your window down and shouting instead at the other person, not that
This
one.
can be helpful.
And I think it's important to determine the root of the anger. I think the other manifestations can actually, if you do look back and delve into the person's life, you might see that there is actually something within him or her that's causing that anger. So none of these techniques would be helpful unless that is resolved.
And when we cut to the break, we will come back and we will talk more about taming your anger, taming your temper, or controlling your anger before it controls you. MedTalk will be back.
According to Nancy Molitor, an assistant professor of clinical psychiatry and behavioral science at the Northwestern University Feinberg School of Medicine, hot and humid weather can be linked to an increase in aggression, violence, and all-over mood. You may feel irritated and moody simply because you may lack sleep, feel dehydrated, or sometimes may even feel helpless in such warm weather.
We're back here on MedTalk, still talking about anger management. Doctors, we have a caller on the line, Lydia Concepcion. Good evening, Lydia.
Good evening.
Yung question mo para sa mga doktor natin.
Okay. Yung question ko po, kasi po yung mabilis po ako magalit and dire-diretso po pagka yung sinagot ako ng anak ko na hindi ko nagustuhan, pero yung answer nila, okay naman.
Okay, so Lydia, yung question mo is paano mo ko-control yung anger mo? Yun ba yun?
Okay, yun po.
Salamat, Lydia. Doctors.
Okay, thank you.
Salamat.
I think, katulad nung sinasabi natin kanina, meron tayong mga magagawa. Yung mga katulad ng paghihinga ng malalim or yung dahan-dahan na pagmamasahe sa mga sa areas para medyo magkalma. Pero katulad nung dapat alalahanin natin na simptomas lang yung anger mismo, simptomas lang yun. Baka may nararamdaman pa si Lydia ng ibang simptomas na kailangan masuri. Kailangan malaman natin kung ano ba talaga yung sitwasyon din sa pamamahay nila. Hindi pwedeng yung simpleng lang. Kailangan mas mas malalim na para malaman talaga natin kung ano talaga yung nagkukos noon.
She mentioned also na palagi siyang galit. Kahit na yung pagsabi nung anak niya, okay naman, malumanay, nagagalit siya.
What's good about Lydia, ako, a suggestion ko is for you to go to a doctor and have yourself checked out, Meron kasing pinanggagalingan there's a root cause for that anger. And matalino siya enough to actually identify that the anger is out of proportion. Even the way yung anak niya who actually answers to her na tama naman, aware siya doon. So may certain guilt that attached to the anger. So this is something that you can actually determine and help with in therapy. So maybe if she has time to come to the clinic and have herself assessed.
Okay. It's easy kasi sometimes to just snap. It's easy to get mad. Sometimes may dahilan, sometimes no reason. Maybe you can blame it on the weather. It's hot and you're hot-headed as well. So last note. Oh, no, we have a question from Facebook, doctors. Can you already consider recurring anger among teenagers as a psychological condition? It's also different dealing with teenagers and their anger.
Actually, the manifestation of anger, for example, in teenagers, they may manifest certain diseases differently when you compare that to adults. For example, in depression, in teenagers, it may manifest as acting out behavior, or truancy, substance use, or anger itself. So again, I think a much more, a deeper investigation should be done in terms of presence of other symptoms aside from the anger itself.
I always say when dealing with teenagers, it's not as easy as one might think. Being a teenager entails a lot of changes. They can be very aggressive given that change. And it can be normal. So when you find yourself questioning whether this is already a normal behavior, I suggest you actually bring your child to a doctor and have them checked out.
What's normal behavior for a teenager when they're angry?
I think teenagers, they're normally at that rebellious stage, in the sense that they want to try everything out. That's when they cut classes, that's when they engage in
high-risk behavior.
Right, in high-risk behavior. But then we also have to, I think, like we were saying, there's no definitive way of diagnosing such disorder. But then if you notice the intensity, the frequency, and the duration of the anger persists, then that should serve as a warning sign for you to have your child assessed.
And ultimately, if they fail to function socially, interpersonally, professionally as a child, you know, they're unable to go to school, they get hurt in the process. These are red flags that one may consider when you think about aggressive or angry behavior in children.
Doctors, we have a question, this time from Twitter. What do I do if I'm confronted by a really angry person who is out of control?
I think you were saying earlier, the important thing is don't engage.
Yes.
Yes.
Take a step back. You don't want to put yourself in a situation that could harm you. So there's really no point trying to calm an angry person down, especially if they become very aggressive. There are trained professionals to deal with this kind of behavior. And even us as doctors, we actually have a technique that we employ to address aggressive behavior. Especially if they have, for instance, a weapon, you bring insecurity, if that is the case. And if they're just very angry, you just have to take a step back and secure your surroundings. So these are the techniques that we use in clinical practice. But if you are a lay person, I would suggest to just take a step back. And especially if you are worried about your safety, leave that situation.
Sometimes the angry person provokes because there's no reaction. So that angry person will just keep on provoking until you, the calm one, you know, you might also just get angry. So even if the angry individual is like that, still, you know, still take a step back. When do you seek professional help? You've mentioned the frequency and the kind of anger that you see often. So when do you seek professional help?
I think, well, apart from we were talking about the frequency, intensity, and duration, I think when it already affects the other domains, the interpersonal relationships, social relationships, work, or if you're a student, the educational, when there's already impairment in these areas, then I think that it's important that you do seek help.
Okay. Doc Ron?
I agree with Robert. Ultimately, if you find yourself having poor function, you're dysfunctional because of your anger, this is the time you shouldn't doubt anything else, seek help. You don't, you know, they say an ounce of prevention is better than a pound of cure.
Yes.
This is the time you actually seek help. Our role is actually to weed out whether or not this is pathologic or not. It's not as easy as pie to actually say, oh, okay, that's normal for me, but you need a professional to actually tell you so.
And Speaking of, we need a professional. We'd like to thank you, professionals, medical experts, for helping us understand and learn more about controlling our anger, dealing with the anger, and what to do when we're confronted with a situation with an angry individual.
You're most welcome.
Thank
you
you
for having us.
Thank you very much. See you again next Tuesday, 7 p.m. on your scheduled on-air consultation here on the Solar News Channel. I'm Angel Jacob. Good night.
Profession, we actually define pathologic anger when one actually has dysfunction in one's life. So from the professional perspective, they cannot work, their relationships are compromised because of the anger. This becomes the problem. Of course, to the highest level would be when they have problems with the legal system. That becomes also pathologic in a sense.
So problems with the legal system,
Yes.
problems in their environment, and
Interpersonal,
interpersonal
social,
and health.
Yes.
Health. What happens to a person's health, or how does the person get affected physically and emotionally when he's angry? What happens?
When a person is actually angry, there are physiologic changes that happen within the body. They might have hypertension, may have experienced migraine. They may experience migraines. They may have tachycardia, increase in the heart rate. That's on the physiological level. But then they may also some patients may also, with chronic anger, they may also experience depression. So there's it affects both the physical and the mental levels.
This is actually what we call a stress response. You know, our body is always assaulted by stress, and how we respond to it affects us.
Mo, or merong pagkakataon na sa sobrang extreme yung galit nito, maaaring atakihin ka pa sa puso.
And when anger gets out of hand and appears to be never-ending, it can also jeopardize your relationships, job, and general well-being.
Ang mahirap dito kasi may mga pagkakataon na you deal with it na nanggigigil ka, tapos ayaw mong ilabas yung galit. So, merong tinatawag tayong suppression. It can turn into a possibility na maging depression. So, yung kaakibat nitong anger nito, maaaring magkaroon ng possible mental disorder.
It can also pose a problem when you're already consuming alcohol and taking illegal drugs just to manage your anger. What techniques can you employ to keep your anger in check? What is the right time to seek professional help? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Robert Mapa, Medical Officer 3 of the National Center for Mental Health. Also with us is Dr. Ronaldo Elepaño III, the Consultation Liaison Psychiatry Fellow of the Department of Psychiatry of the Medical City. You may join our discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening, Angel.
Anger.
Psychologist or psychoanalyst will explain it as a means to temper one's feelings, because there's ambivalence, there's a lot of feelings that are contradicting within oneself that produces anger. Some of them would be guilt, some of them would be depression. Anger could be a means to punishment, and a lot of other things, you know.
And this type of anger to self and to others, I understand there are certain levels. Because can one be angry and be calm?
One be
Angry and still calm? Is that possible?
Yes,
Na you're
actually.
angry pero kalmado ka?
Yes,
Posible
yes.
ba yun?
Yes,
And
actually.
I am asking this because there are certain levels. No? If you're calm and you're angry, then flip side is that you really are enraged by a certain situation or a certain person. So are there different levels of anger that we should know and understand?
It can range. It covers a vast spectrum. Some makes a bit mild or moderate anger, and then on the other side, you have persons who have expressed fury or rage. But then that's the line actually between The actual spectrum is very vague. So you cannot really put a definitive.
There's no working definition as to the levels of anger, but in our
Standing anger, which is a normal human emotion, but it can affect our health, our mental and physical well-being. Let's understand anger first. What is anger? Dr.
Anger
Robert?
actually is as you were saying earlier, it's a normal human emotion. So if you would want to define it, it's characteristically an antagonistic behavior towards someone or something that you feel may have wronged you.
It can also be a form of aggressive behavior, so it can be manifested physically and internally. So this will then be defined as the types of anger. So there's anger towards self, and then anger towards others.
So there's anger towards self and towards others, and there are certain triggers that make you get angry at yourself and at others. So what are these triggers?
To simplify it, let's, for the sake of the audience,
Yes,
you
please.
know, anger towards others is the easier thing to define. Anything can make you angry, you know. The traffic situation, your boss, a loved one can actually make you angry. And the more difficult part to define is what triggers you when you have anger towards self, you know. It's more
This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel. Anger is considered an entirely normal behavior.
Pag sinabi mong anger, it's a kind of emotion na ine-express pag meron kang mga frustrations, failures, yung mga takot mo, na kumisan, pag wala kang ibang ma-express na emotion kung hindi itong tinatawag nating anger.
Your anger may spring from an unpleasant experience or lingering problem at home, or a traumatic event that happened to you in the past.
Magkakaroon ka ng physiological effect. Yan yung tumataas yung blood pressure.